Capitation payments are payments agreed upon in contract by a health insurance company and medical provider. Under this approach, a health insurance company would pay the provider a fixed amount per enrolled patient for a specific amount of time, regardless of whether the individual requires or seeks care and treatment or not. The goal of capitation payments is to incentivize healthcare providers to provide appropriate care and treatment to increase health and wellness. The important thing is that the insurance company can understand well how much it is going to pay for a patient. The amount of payment is decided before the coming year based on the local cost and expected average utilization of services by a patient, as well as some personal characteristics of the patient like age and medical history. Thus, the amount of payment should cover the patient's need for the treatment in a given time frame. To reduce the total amount of payment, companies will provide a better price for necessary treatment as an incentive, and they also will lower the price of unnecessary expensive treatments. Thus, providers will be more willing to provide those cheap and necessary treatments and avoid unnecessary expensive treatments to reduce their costs and earn more profits while getting patients better. On the other hand, the provider can receive the money only after the patient's health condition meets the requirements of the contract. So if the provider gives insufficient treatment to save money, it is very likely that it has to input more resources to fulfill the contract requirements and actually raises the cost in the end.
For example, a patient is being treated in the hospital, and the insurance company pays his medical fee to the hospital through capitation payment. With capitation payment, the patient will only receive necessary treatment that can fulfill the medical contract. Assuming doctors can receive $50 for every patient treated per month, then a doctor can only get $50 from the insurance company to treat this patient. And the doctor doesn't get paid extra if providing some extra unnecessary treatment. Thus, the incentive in a fee-for-service system that can get doctors to do more things is taken away. If the patient doesn't have such insurance of capitation and he is in the fee-for-service payment, then the hospital may provide him a bill with a lot of expensive and unnecessary treatments. Because the more service physician provide, the more money they can get in a fee-for-service system. On the other hand, capitation will also bring some problems. The most important one is discrimination in this field. In order to ensure the profits from the contracts, providers are more likely to reject some patients who are not easy to cure. By accepting only healthy patients, providers can earn capitation payments without giving any services, so their costs are lower and their profits will be higher. Moreover, because the revenue that a healthcare provider can get from one patient is fixed in the given time, the profit of the provider then largely depends on the number of patients he gets. Thus, the capitation payment incentivizes doctors to enroll as many patients as possible, leaving less and less time to treat a patient. All of these are what we do not want to see in modern society.